It's great conversation, and thank you very much. Now the gentleman from Arkansas, Mr. Westerman, is recognized for 5 minutes.
Thank you, Madam Chair, and thank you to the panel for being here today. You know, it was mentioned that a lot of people want to keep the Affordable Care Act in place. They're fearful that it might go away, but I'll remind the committee that millions of Americans were fearful that they might lose their doctor or their premiums would go up, but they were promised they could keep their doctor. They were told their premiums would go down by $2,500, but from the testimony here today, we've heard that there's been increased premium costs, there's been increased taxpayer costs. People indeed are seeing higher deductibles, they're seeing fewer benefits, they're seeing reduced access. There's been talk about Medicare and what might happen to Medicare, but I'd also remind the committee that when the ACA was passed, that there were cuts to Medicare reimbursements in the Affordable Care Act to pay for Medicaid expansion and the exchange policies, as much as over $700 billion in those cuts to Medicare. I was visiting with a neurosurgeon from my state who has been affected by the cuts to Medicare. He explained it like this: certain surgery might take five steps to the surgery, and Medicare pays for 2 of them. And he assured me that if there's anything he knows about the Affordable Care Act, was that whoever wrote it knew absolutely nothing about medical care. We've heard about the number of people who have benefited from the Affordable Care Act. There's really no consensus on that number from the panel. I believe there is consensus that most of the people who have benefited from the Affordable Care Act are in the Medicaid population. I know that was definitely true in my state. There's arguments about how many people could have already received Medicaid who qualified for it, the woodwork effect, that actually signed up for Medicaid because of the expansion. And you know, if we just take Dr. Bloomberg's number of 20 million people who benefited from the Affordable Care Act, if we look at the population of our country, that's 6.2% of our country. So we could say 6.2% possibly got more because of the Affordable Care Act. But I think we fail to remember that 93.8% of Americans are getting less for more because of the Affordable Care Act. As a state legislator in Arkansas, I lived through the debate on Medicaid expansion, and our state did expand Medicaid. It was supposedly an innovative plan that didn't expand traditional Medicaid, but used Medicaid dollars that come from an apparently bottomless pit of money in DC to buy private health insurance. So the 324,000 Arkansans that are now on Medicaid that weren't before have a very nice health insurance plan. They've got a Blue Cross plan that they pay nothing for. They don't have a deductible, and it pays the providers very well, but it comes at a tremendous cost. And now over a third of my state is receiving benefits through the Medicaid program. So, Mr. Hasselmeyer, I want to ask you a question on the Medicaid part. Was the traditional Medicaid system for the aged, the blind, and the disabled, was it having any problems before the Affordable Care Act?
Well, it depends on the state, but yes, I mean, there were clearly problems in the program.
Yeah, I know from my experience there were huge problems in the Medicaid program. And the follow-up to that is, did the ACA do anything to address the underlying problems with Medicaid, or did it simply add a new layer of...
It was mainly an expansion.
Yeah.
It expanded to a new population. They did make some other changes to the program, but they were largely around the areas of eligibility.
So the 324,000 in my state, take away about 7% of that for the woodwork, we're all able-bodied, working-age adults that aren't even part of the traditional Medicaid system, the aged, blind, the disabled. Do you believe the traditional Medicaid population across the country has suffered any damage because of the expansion for the able-bodied adults?
The problem with it is not just so much the expansion. That increases the caseload. But the problem is that there is a sort of inequity in basically the federal government paying the states more for people who need the program less, and paying them less for people who need the program more. I mean, my classic example of this was...
Do you think states need more flexibility to design their own Medicaid plans?
Well, in general, but I think also in particular with this population. I mean, one of the things we've learned both in terms of the Medicaid expansion and the subsidies for the very low income and the ACA is that these are people who will show up when they need medical care, but they're not going to stick with it afterwards. And you have to really direct them away from the emergency room. And
The
Medicaid
gentleman's
is not
time
set
has
up to do that.
expired. The gentlelady from Florida, Ms.